Welcome back to Social Work 6500 Psychopathology. I'm your professor, Lisa Gleich. This week, we'll learn about 3 different categories of mental disorders, including anxiety disorders, obsessive compulsive and related disorders, and trauma and stressor related disorders. You will find the section on anxiety disorders all share common features of fear and anxiety. Specifically, you will learn about separation anxiety disorder, selective mutism, specific phobias, social anxiety, panic disorders, agoraphobia, and generalized anxiety disorder. The section on obsessive compulsive and related disorders will present information on body dysmorphic disorder, hoarding disorder, trichotillomania, hair pulling disorder, and excoriation, skin picking disorder. Although there is an overlap of symptoms among the anxiety disorders, PTSD, and obsessive compulsive disorder, these syndromes have a different clinical presentation. Almost all disorders have some relationship to adverse life events. The trauma and stressor related disorders relate to exposure to a trauma or stressful event. You will learn about reactive attachment disorder, disinhibited social engagement disorder, PTSD, acute stress disorder, and adjustment disorders. Each disorder also reviews the impact of substance, medication-induced conditions, and other specified and unspecified disorders. Case studies for all disorders are included in order to highlight the various disorders' symptomatic features as well as the competency-based assessment. In the reading this week, we'll be reading from the Psychopathology textbook by Gray and Zide, Chapters 6, Anxiety Disorders, Chapter 7, Obsessive Compulsive and Related Disorders, and Chapter 8, Trauma and Stressor Related Disorders. Also review the PowerPoints for each of these chapters. In the DSM, Section 2, we'll be reviewing anxiety disorders, pages 189 to 234, obsessive compulsive and related disorders, pages 235 to 264, and trauma and stressor related disorders, pages 265 to 290. This week, we will have 2 discussion forums. Discussion forum number 1 says, for this discussion forum, read the following brief case examples. Your post will include your determination whether the person's anxiety is abnormal or considered normal. If you determine the anxiety is abnormal, assign the most likely DSM-5 diagnosis and include the diagnostic criteria you use to make this diagnosis. If you determine the anxiety is normal, support the conclusion with an example of why you determined this. Your initial post will be due Thursday at 11:55 p.m. and be 300 words. Then you should respond to 2 other learners' posts by Sunday at 11:55 p.m. Week 4 discussion forum number 2 gives you 2 different options, either option A or option B. Please pick only one to respond to. Option A says, watch one of the films listed here and answer questions in your discussion. The films to select from portray PTSD and some involve suicide. They include The War at Home, The Deer Hunter, Coming Home, American Sniper, or any other movie that you have watched that primarily involves PTSD. And then answer the discussion questions that are asked. Option B is research and respond to the following. Secondary traumatization and compassion fatigue comes about as a result of empathetic engagement with another's trauma and can affect social workers. For your discussion post, identify the effects of compassion fatigue on social workers and make a list of suggestions about what can be done if this happens to you or another professional. Imagine you are a clinical supervisor who is concerned about a supervisee who is showing signs of compassion fatigue, such as absenteeism, becoming cynical about clients, late in submitting reports, and so on. How would you bring up these concerns in your supervision? And last but not least, this week we have a midterm course evaluation. So please go to that course evaluation and either let us know your comments and feedbacks of ways to make the class better, or let us know what you liked about the class. Both are very valuable. So if you have any questions about week 4, please feel free to contact me by email at lgleich, which is GLEICH, at aurora.edu. You can call or text me on my cell phone, which is area code 847-833-2907, or we can meet in an Adobe Connect chat room. Thank you so much and have a great week.